on and not. So welcome everybody to the second virtual meeting of the Science Advisory Board. Thanks so much for the members for joining. Particular thanks for the staff support. We have Peter Johnston doing IT support. We have Louise Hughes back and Mercedes Hernandez helping. Appreciate it if all of you guys could look at the chat throughout the day and see if I'm missing anything or a raised hand, and be partners in helping run the meeting here today. Welcome senior agency staff. I see we have Sheila Holman and Zach and Virginia. Thanks for joining us amid your busy day. And I think with that, I will call the meeting to order and suggest that we review and approve the agenda, which is the first item for business. The agenda was sent around on September 24th. It has not changed. It continues to be an abbreviated agenda in respect of everybody's time and dealing with the priorities that the pandemic brings for the health agencies. I intend to have this done by 2 o'clock, focused on just 2 topics with a long break in the middle for people to get lunch, check emails, and then come back to jump into a new topic for us. And I'll ask if there's any additions, corrections, or questions on the agenda. Well, hearing none, it would be appropriate for a motion to adopt the agenda as written. And just a reminder to the members that in this virtual setting, just tell us your name and the motion.
This is Jamie DeWitt. I move that we approve the agenda.
Thank you. And is there a second?
This is Richard DiGiulio. I second.
Thank you, Rich. All right, and I believe it's still the practice that we have to take in the virtual setting for me to have a roll call vote on this. So just yay or nay as I call your name on the action of approving the agenda as written. So Vani and Neha. And Jamie.
Yay.
And Rich?
Yes.
Dave Dorman? Dave did tell me he may be a little bit late. He was teaching class and needed to make his way back home, so we'll expect him to join a little bit. Elena?
Yes.
Thank you. Detlef? Gina?
This is Gina. Yay.
Thank you. Tom Starr? Philip? Philip, you may be on mute. Or he may have had to leave for a minute. And Betsy?
Yep.
Okay. There's enough yes votes there, along with no votes, that the agenda passes, and then we'll proceed into it. The next step for which is the ethics statement. So Louise, if you don't mind pulling that up onto the screen for people, I'll read it and people can look at it as well. And again, the 2 parts here that are important are genuine conflicts or the appearance of such. So in accordance with the State Government Ethics Act, it is the duty of every board member to avoid both conflicts of interest and the appearances of conflict. If any board member has any known conflict of interest or is aware of facts that might create the appearance of such conflict with respect to any matters coming before the board today, please identify the conflict or the facts that might create the appearance of a conflict to ensure that any inappropriate participation in that matter may be avoided. If at any time a new matter arises or raises a conflict during the meeting, please be sure to identify it at that time. So I will open the floor to see if anybody has input on that for the benefit of the group and all the participants.
This is Jamie. I'd like to share some potential conflicts.
You have the floor.
Okay, so I am a co-author on 2 of the papers that you shared with the board, one first authored by Cousins and one first authored by Kwiatkowski. I also am an active collaborator with Dr. Ian Cousins, who will be presenting at the meeting later today.
Thank you. Others? Anyone else? Okay. Before we move on to the approval of the meeting minutes, which I can put on the screen if I guess we might not need that. We'd only need that if there were edits. I will say that we had a request for 6 public speakers, and 4 of those will be on the topic of Pfas, and then 2 other topics. Those will all be during the public forum at the end. And so if people have joined us, thank you. We appreciate it. And I will call on those 6 individuals at the public forum near the end. So I think that moves us on to the approval of the meeting minutes from August 31st. August 31st was an off-scheduled meeting, a meeting that we delayed because of the hurricane that had come through at the beginning of the month. The meeting minutes were done in draft by Mercedes Hernandez, done very well, thank you. They were circulated 2 Thursdays ago, and they have not changed since. I'll note that I failed to do a couple of accepting track changes in there to make one item bold. I see that we need to correct Detlef's first name in one location, and then there was one other typo to fix. Is there anything else that needs to be changed in the meeting minutes, or any questions about them? All right. Well, then be our practice for a motion to accept the minutes as drafted with the couple of track changes, corrections that are noted.
This is Jamie DeWitt, so moved.
Thank you, Jamie. And is there a second of Jamie's motion?
A second.
And who is that?
This is Detlef.
Thank you, Detlef. Glad you could join us. And this will be our second roll call vote, this time for approval of the meeting minutes. Benny, Maneha? Jamie?
Yes.
Thank you. Rich?
Yes.
Thank you. Dave Dorman, if you've been able to join yet. Maybe the next one. Elena?
Yes, approve.
And Detlef?
Yes.
Gina?
Yes.
Tom Star? Philip? Philip may have had to step away again. Betsy?
Yep.
All right. So that passes. Thank you. And thank you again, Mercedes, for a good job on the notes. That made, that was quite easy to pass. And I'll ask that Louise make those last couple of edits that are noted and put it on the website for others to see. We're at the spot of the agenda where I would call on agency senior leaders for updates, but that we had comprehensive updates from them at our hospital meeting in late August. I will, while they're thinking about what they might have to share a couple of items. I wanted to welcome back Louise Hughes from her detail, and to thank Bridget Morris McClawhorn for her help administrative support wise over the last few weeks. The SAB has been in good hands, and I appreciate the help of those 2 executive assistants. I'll also note that this month marks 3 years that the Science Advisory Board has been reconstituted in its new form with an expanded participation and expanded charter. The charter was written in October 2017, and since that time, the members have covered a lot. We've covered science support on Gen X, methyl bromide, trichloroethylene, PFOA, Pfas, and hexavalent chromium. We have said goodbye for various reasons to Doctors Jamie Bartram, Greg Hope, Jackie McDonald Gibson, Sandy Stopford, and Science Liaison Sandy Mort, and we have welcomed Jamie DeWitt. The work of the board is important, and I wanted to thank, for 3 years of service, thank Betsy, Elena, Gina, Rich, Detlef, Michael, Philip, Tom, John, David, and Vinnie. Thanks so much for your help the last 3 years. And with that, I will call on Sheila for any updates from DEQ.
Good morning. Thank you, Chairman Augsburger. I want to add to the welcome back to Louise. It's good to have her back working not only with the Science Advisory Board, but helping keep my calendar and all my other things straight as I carry out my duties. I do want to also express appreciation to Bridget. She was very much instrumental in keeping me sane for a couple months while Louise was on her deployment. Let me mention also to Peter Johnson, I saw that Dr. Dave Dorman is in the attendee list. If he can be moved to the panelist, please.
Yes, I will do that.
Thank you. I also want to say thank you to all of the board members for the dedication and the continued work and sharing of your expertise to the state as we've tackled these very complicated issues. It's hard to believe it's been 3 years, but it certainly has. I wanted to mention on the COVID-19 front that many of you probably saw that Governor Cooper has moved the state into phase 3. That being said, the indoor setting, the maximum participation is still 25 attendees. So given that the secretary has asked that we continue to hold board and commission meetings virtually, I think it would be too difficult to try and manage just a 25-member audience, and also making sure that we had appropriate space to keep those 25 individuals socially distanced. So at least through the end of the year, we'll continue to hold these meetings as well as other board and commission meetings virtually. And I appreciate everyone's patience as we continue to conduct our work this way. I would also say, I know those of you who are listening in at the start of the call, Louise mentioning very few people going into the DEQ buildings. I will say that the majority of the DEQ staff continues to work remotely and continue to try and keep not only staff safe, but the public safe. So appreciate your patience again as we continue to maneuver our way through this particular pandemic. I wanted to note that the environmental toxicologist position, the one that was vacated by Sandy Mort, that vacancy closes today. I want to thank all the board members who helped in circulating the vacancy posting. So I hope to be able to announce our next environmental toxicologist at the December meeting. Since we last met, the Environmental Management Commission took up the issue of methyl bromide following public hearings. And at this time, I would like to ask Mike Abrazinskis, the Director of the Division of Air Quality, to give just a brief summary of the EMC action. Mike?
Thank you, Sheila, and good morning, everyone. So I'll provide a quick update on the status of the rulemaking to establish an acceptable ambient level, or AAL, for methyl bromide, as it will apply to log fumigation operations. So on September 10th, the EMC took a final action to establish a pair of AALs for methyl bromide that addresses both the short-term or acute exposure scenarios and longer-term chronic exposure scenarios. Specifically, a 0.005 milligram per cubic meter annual average AAL paired with a 1.0 milligram per cubic meter 24-hour average AAL were adopted. Facilities subject to these rules will have to demonstrate compliance with both of those AALs, and the division will be working through a permitting process that includes modeling after the rule becomes effective, and it's possible the effective date will be as soon as November 1st. So really just wanted to say a sincere thank you to the SAB this morning for your work in 2018 and 2019 on this matter. And we at the Division of Air Quality are looking forward to implementing the rules that are going to provide public health protections nearby the emission sources of this compound. So that's all from me this morning, Sheila, and I'll hand it back to you. Thanks.
Thank you, Mike. I appreciate that update. Also, another note for Peter Johnson. I also see Dr. Vinay Anesia and Dr. Tom Starr again in the attendee list. If you can move both of those to the, to the panelists.
Yes.
Thank you, sir. And that concludes the DEQ update. At this time, I will pass the microphone to Dr. Zach Moore with DHHS. Zach?
Hey, thanks. Can you all hear me okay?
Oh, we can. Thanks.
All right. Wonders of technology. I just wanted to also add my thanks to Chairman Augsburger, who's been doing a tremendous amount of work to keep things on track with this important work of the SAB, despite the many challenges, including many of us being somewhat unavailable. So thank you so much for continuing those efforts. I have several updates to provide. I will start off just with a very brief COVID update, which is that, we had seen overall declines since a peak in July, and then we got a bump with the college students in sort of mid to late August, and started declining again, but we are heading back up in terms of reported cases, and we've seen some increasing concerning trends in some other indicators, including the percentage of tests that are positive, as well as some of our syndromic surveillance data, the visits to emergency departments for symptoms consistent with COVID in the last couple of weeks really seems to be not localized to any one part of the state, not driven by any one particular age group, et cetera, but just sort of general increases. Unfortunately, that mirrors what's happening in a lot of the country. So we are working very intensively on redoubling all the prevention efforts that are going on, and the trying to be as focused as possible with the response. So that's kind of broadly speaking where things stand right now. I will say that flu season is here officially in terms of when CDC starts putting out weekly reports, and we will start doing that this Thursday, which is to say, please go get your flu shot if you have not already. We more than ever really need people protected against flu, so that we don't run into issues with our healthcare capacity, and of course, just for them to be safe themselves. We've seen a good response so far, which is better than normal for this time of year with flu vaccination, but we never really get much above 50% of our population, so we have so much room for improvement there. So just putting in a plug, and then thank you to Dr. Tilson and the many other people who are working on our COVID vaccine plans, getting ready for expected availability of one or likely multiple COVID vaccines sometime in the not too distant future. So lots of planning work happening there. I think that's probably all I'll say about COVID, except just to note that within our occupational environmental epidemiology branch headed by Dr. Guidry, who's on the line, there's a lot of work being done on the COVID front, particularly looking at specific occupational settings and providing support to protect workers in high-risk settings. Also looking at wastewater surveillance, which is a big hot topic and something that's emerging, and we have been selected as one of the pilot states by CDC for participation in the COVID National Wastewater Surveillance Network, and going to be working with our academic partners on that. Also working on safe disinfection practices in various settings, including schools and child cares and many other things. So just to let you know that that's along with their continuing work on important issues that will be discussed today, where their focus has been over the past many months now. On the PFAS front, I guess there's a couple of updates to share. First, we are continuing to recruit for our focus groups for feedback on health education materials and outreach materials. Of course, those are going to be shifting to virtual now, but that is ongoing work. And then in terms of our research collaborations, CDC has launched a study on ecological analyses of PFAS in public water supplies, looking at levels in the public water supplies and selected health effects. North Carolina was one of 9 states that were selected to participate in that. So we will be, through our State Center of Health Statistics, providing information for those analyses on some of the endpoints they're looking at, including cancer data and some information from our vital records, our birth and death certificates on certain specific outcomes of interest, including certain selected birth outcomes, birth defects, pregnancy-induced hypertension, et cetera. We continue working with NC State University colleagues to support the Gen X exposure study, which there continues to be a lot of work there. And then lastly, on the research collaboration side with PFAS, there's a new EPA-funded PFAS exposure study that's being started with colleagues at the Research Triangle Institute and Indiana University, with our former board member, Jackie McDonald Gibson, as the principal investigator. That's called Predicting and Communicating PFAS Exposure Risks from Rural Private Wells. Lots of components to that. Our PFAS community survey results were useful to them. They used that in the grant application to show the need for funding for this project. There's several different things that will be done as a part of that, including the first national citizen science PFAS monitoring campaign in rural and private wells, and also modeling PFAS testing, risk assessment, and risk communication approach to improve risk prediction and facilitate risk management decisions. So that is getting underway. In terms of the PFAS network, PFAS testing network, or PFAS network, they are hosting a series of webinars this fall to share some of their findings, and we continue to serve on the stakeholder advisory committee there. And then lastly, for PFAS, Duke University has conducted some water and serum PFAS testing in the Pittsboro area, and those results will be shared soon. There's a public town hall scheduled October 24th, and we will have participation from DHHS in that. A couple other non-PFAS related things. In terms of well water, our CDC-funded private well and health program is going to be sending out a survey this month to approximately 12,000 residents, assessing receipt of well water testing results, feedback on health risk evaluations, and actions that were taken to get a better picture there. And then we also have recently received an award from CDC for building resilience and environmental health capacity to look at environmental health data in the state. So there's lots that will be happening there, but that includes launching an environmental health data dashboard modeled after CDC's environmental public health tracking program to make the environmental health data more accessible to the public. Lots there. We'll be analyzing barriers to accessing safe drinking water and implementing strategies to improve that access, and many other activities that will hopefully be getting underway soon. And then lastly, on the climate and health front, our staff are continuing to work with the Interagency Climate Council on efforts to identify and address health concerns associated with climate change. And we're also supporting the broader Department of Health and Human Services to add to the North Carolina Early Childhood Action Plan to incorporate anticipated health effects of climate change on children ages 0 to 8 and how to minimize those. And that's a whirlwind tour of some of the things going on. I think that concludes my update.
Well, thank you both, Sheila and Zach, for the news and your partnership in environmental protection work. I'm going to pause and let any of the board members ask questions if they have them for Sheila or Zach.
Dr. Asperger, this is Philip. Can I ask a quick question of Dr. Moore?
Sure, Philip.
And Zach, I probably should do this offline, but I'm not being flip. We're working with Dr. Cahoon at UNCW, specifically wastewater, or at least getting some data on wastewater. At least with our system, with chloramine and UV lighting, I'm thinking of wastewater distribution of COVID.
I'm sorry, Philip. You were breaking up a little. I couldn't quite hear.
I was going to ask Zach that we're working with UNCW specific to some studies on wastewater and COVID. Is there I guess from a public health perspective, trying to find maybe the validity, and that's probably a terrible word for this group, but with K-Fair Public Utilities, the chloramine and UV treatment systems, what from the public health perspective at the state is the end goal? Is it just the distribution of COVID that exits the system, enters the water stream? What is that goal? Because I've been working with Cahoon on that, trying to figure it out.
Yeah, thank you for for the question and the opportunity to clarify. So the utility of wastewater surveillance, which is being done both at the municipal level and then in some cases at a facility level, is really for surveillance, for detecting either when there's new cases or an uptick. And there have been research to show that you can identify trends earlier through wastewater surveillance in some situations than you can through testing results from the actual population or from the residents. So that's really the intent, is to make use of this technology to get sort of more rapid and better and maybe potentially lower cost surveillance data on the municipal level or on the finer level. So it's not about disinfection of wastewater or of the safety of the water supply, which is that's not really part of it. Those are issues that are pretty well established in terms of current wastewater treatment and ability to provide safe drinking water. So it's really about surveillance and about understanding where and when COVID activity is increasing.
Perfect. Okay. Thank you.
Mm-hmm.
Other questions for Zach or Sheila or for Mike Brzezinskis? Okay. Well, thank you all for the newsy updates. We appreciate it. We're at a spot on the agenda, and I'll note that we've been joined by Tom Starr and Vani Aneha and Dave Dorman. So we have everybody that we expected to have today. And we're moving into what I think will be the final stages on hexavalent chromium recommendations to the state. And I'm going to ask for the ability to share the screen to walk us through the spreadsheet. While I do that, I'll note a couple of things for board members and anybody else interested in the path forward. Just to walk it back a few steps to reset it. It was February of this year, February 2020, that the board approved their draft recommendations to go to public comment. They were posted for 45 days of public comment, which closed June 1st. On June 15th, all the comments were provided to board members, and we spent our August meeting, August 31st, reviewing comment by comment, putting those comments into bins of those that we thought were sharing different perspectives, those that were opportunities for clarifications or additional context. And we flagged 9 comments in particular. We flagged 9 comments where the commenter was indicating that there was an error in either the write-up or our interpretation. So we flagged those as meriting special attention in follow-up. And thanks to the helpful homework from Gina and Jamie, who volunteered to dig into those 9 comments, on September 24th, we shared with the board members a spreadsheet which included a column that had their feedback on those 9 items. Those 9 items are highlighted in yellow on the spreadsheet. And the spreadsheet that I'll show is the same one that you were emailed on September 24th. And so you can follow along on the screen, or you may find it easier to follow along on the spreadsheet, and I'll try to call out where we are on the spreadsheet. I don't know of another way to do it other than what I'm going to propose, which is to look at those 9 comments. And we're not going to need a vote on them, but I will be looking for either your concurrence or your direction on what changes, if any, would need to be made in a revised draft. And the plan would be to have a revised draft available next month for internal review and hopefully a vote on December 7th at the next SAB meeting. So today's goal is for board discernment and guidance on what, if any, changes would be necessary for these 9 items so that we can prepare a revised draft that you'll have a few weeks to sit with next month in preparation for December. So let me ask if folks are seeing the screen that I'm sharing now with the spreadsheet. And before we dig into it, let me just ask board members if there's any questions on the path forward, which is to look at the yellow highlighted items that we flagged from August. Column C has either Gina's or Jamie's feedback on those, and get your guidance on what, if any, changes you'd like to see made from draft to final, so that a revised draft that's available for your review next month will be guided by your input. Any questions on the path forward? And I'll just pause here for a second that says there is an outside question that Louise has received. So sure, you can let us know that question, Louise, since there's no questions from the board.
There is an outside question, and I'm trying to expand it so I can see it. I'm sorry. Give me a moment. Regarding the draft report, lines 603 to 604 read, this was a majority view. One member thought no science-guided policy recommendations should be offered. Please speak about the dissenting opinion. What other type of recommendation was suggested?
So let's try to get at that one near the end after we've moved through the business aspect of it, which is clarity on the comments received. We will have time to open it up for any additional comments or questions, including that one at the end. But I'd like us to focus on clarity for the 9 items that we flagged at the last meeting for continuity and progress. Any questions from the board on that as a path forward? All right. So the first one, what you have on column B, line 6 is the comment, and C is the homework that in this case Jamie did, digging into the references that we cited. I'm going to leave it up there for a little bit for people to read, and if anybody wants to jump in with their perspective on whether a change would be needed in what we wrote, that'll be helpful. So Jamie, do you mind maybe paraphrasing what your homework was on this one? And then we'll see if there's any board consensus on your suggested path forward, which was that there was no change needed.
Sure, no problem. So the petitioner provided comments may have not properly interpreted some of the findings of the International Agency for Research on Cancer, the Agency for Toxic Substances and Disease Registry, and then they also included some additional information from the Texas Council, I think Council on Environmental Quality with respect to hexavalent chromium. And so I went to the documents that the board referenced in the report on hexavalent chromium and provided here the exact wording from those 3 different documents that the petitioner brought up. And based on what I've provided here, it does not appear as if the board was confused or mistaken in how those documents were interpreted. So I don't believe that a specific change is required in the board's hexavalent chromium document. We may want to provide some additional supportive materials from the references so that the context is right there. But we provide those reference links and we appropriately cite those references. So it's really up to the board if we want to provide some additional context, which would be paraphrases or quotes from those 3 documents provided or referenced by the petitioner.
Thank you, Jamie. So it'd be good to hear from as many board members as positive on your own perspective on this. It sounds like Jamie's saying there's an opportunity to expand a discussion to address the comment, but that there would be no change required in terms of our interpretation. Anyone else feel like sharing your perspective on this particular question and comment? And I'll remind you that when you join, just tell us who you are and then proceed from there, since not everybody can see each other.
Tom, this is Dave Dorman.
All right, Dave, thank you.
So I would agree that I think the way that Jamie has looked at this comment, I would agree with. I mean, I'm very familiar with how IR does things, and I think part of the important thing too is even absent a mode of action, there's still sufficient data regarding the carcinogenicity. But I think it's a good write-up.
Thank you, David. Others?
Richard DiGiulio, yeah, I agree. I think Jamie's done a great job responding to this, and I agree. I don't think there's changes required.
Thank you, Rich.
This is Detlef. I also agree that Jamie did an excellent job, clarifying some of the items in question, and I would support, maybe strengthening the language in response to the comment so that there's, less room for ambiguity here.
All right, thank you, Detlef. Anyone else on this one, or we'll move to the second of the 9? Okay. The second of the 9 is similar because these are in order, so it's from the same commenter. And I realize this part of the peer review process, especially virtually, is a little tedious. Appreciate your patience in walking through each of these 9 comments. I don't know of another way to do it when we can't all get around a table and open the references together. But I'll remind you that this is the near final step for our work on this. So I appreciate your patience as we work through this aspect of peer review, which is an important step. So let me move down a couple of lines. We had comments that we said were perspectives and for which we said we could provide more context. But here's the next one, line 14, for those following along separately, column B. And I guess I'll suggest that unless anyone differs, that Jamie's indicating that this is a very similar comment to the one that we just went through, and we would treat it the same. Any other perspectives on that? Or let me first pass it to Jamie and say, did I interpret that correctly?
Yes, sir, you interpreted that correctly.
So others? Then let's move to the next one, which is line 16, column B is the comment. And C is suggested is the homework that was done in response. I'll let people read that for a minute. All right. Any feedback on this one with regard to how we handle it in a revision?
So Tom, this is Dave Dorman again. So I'm
Yep.
not sure I understand why we even need to try to link these two together. IARC in its most recent guidance in their monographs will separate epigenetic from mutagenicity, and I'm not sure that I understand why our document's trying to merge them. Is that actually even needed in our document in any way? Does it add any additional clarity?
Meaning that perhaps what's needed there is a revision just to consider them separately as additional lines of evidence rather than make a linkage, which I frankly don't recall how tightly we made in the draft.
Yeah,
Is that the point you're making?
That's my point, exactly.
Mm-hmm. Other perspectives on that? Thank you, Dave.
Well, this is Jamie DeWitt. I would agree with that. I think if there's already a distinction being made by an entity such as IARC, then we should probably make that distinction and make it clear in our document as well. So I support Dr. Dorman's suggestion to make sure that those are 2 lines of evidence.
And others, either concurring or differing or alternate opinions or perspectives?
Richard DiGiulio, I concur with David's modification.
Thank you, Rich. Last call for this one in terms of any other perspectives on other than the one that we captured here, which is to uncouple those to the extent that they're coupled in the draft, which will both address the comment and maintain the resolution that we have there. And that moves us about a third of the way through the comments received. We'll move on to line 18. Column B is the comment. Let me scroll up a little bit. I said, yep. So I'll let people read that, as well as Jamie's digging into the reference that we cited. So Jamie, could I impose upon you again, just to paraphrase the feedback here? I'll start at least though by saying that your last point is that the commenter may imply that we were referencing ATSDR, which we're not in this case, but in terms of the substance of the comment, Can you give us a summary?
Sure. The commenter, and sorry, I misspoke earlier and said petitioner. The commenter suggested that we wrote something in the report that was inconsistent with the Agency for Toxic Substances and Disease Registry. So I went to the ATSDR report from 2012 and looked at what they wrote and looked at their figures. And I disagree that we were inconsistent with ATSDR. They clearly demonstrate in figure 3-8 that there is a risk of genotoxicity from inhalation exposure in human populations. And I also noted that the majority of human studies included in the ATSDR report were from inhalation exposures, especially those working in an occupational capacity with hexavalent chromium. So I don't believe that we are inconsistent with the ATSDR conclusions or with the data that they present.
Thank you, Jamie. Any other perspectives from the board on the comment or the feedback, in particular, whether or not any change would need to be made in the next version of the document that you'll see next month?
And so I guess I should clarify, this is Jamie D. Witt again, that I don't think that we need to change anything in the current version of this section of the report.
Thank you for that clarification. Other perspectives?
This is Detlef. I agree with what has been said already. I have a procedural question. If we're not making changes in the report, which I agree for this one is not really necessary, is there still a plan to respond directly to those comments? And the responses are nicely already put together. Just curious on procedure.
I didn't have that as a procedure, and I'll confess I don't know from a state perspective whether there's an obligation for that kind of a responsiveness summary. It wouldn't be hard between the meeting minutes and the summaries that we have to at least prepare a document that would go along with the final, noting the comments received and how we handled them.
It's an effort.
That's the approach that we're on. The approach that we're on is that all comments have been shared transparently with the public through these meetings, and our discussions in August and today are recorded for folks to see how we dealt with them. Right. There isn't a written responsiveness summary other than the one here, but I suppose there could be.
Well, is this document in essence, this file is a response, right?
Yes.
It is available.
Mm-hmm. Mm-hmm. Yes, this is available, and there are opportunities, to add clarity in the next version of the document, like Dave suggested in the previous comment.
Thank you.
Mm-hmm.
Tom, this is Veena Aneja. I have a question for clarity for Jamie to help me clarity on this issue. Since it is a chromium 6 is in this particular statement deals with inhalation, do we need to specify or do we need to clarify what the form of inhalation is, i.e. particulate matter, the size, or whatever?
So this is Jamie. That would require me going back to the ATSDR document and looking at those figures to determine if that level of granularity is necessary.
But the question that can be asked Jamie, is if we don't have that granularity, how do we know that chromium-6 is indeed working its way to the cellular level to create the impact that it does?
Well, I think all of the agencies, when they've, and somebody more familiar with the carcinogenicity of hexavalent chromium might be able to answer this. But my understanding is that all of the studies understand that hexavalent chromium is metabolized, so it's modified. So that form of chromium in and of itself might not be responsible for the carcinogenic effects. It may be a metabolic constituent, and I don't understand the toxicokinetics and toxicodynamics of hexavalent chromium as well as maybe some of the other board members. But I could certainly go back to the ATSDI report and look to see how they characterize their assumptions or their conclusions.
Jamie, thank you very much. If you could just send me as a sidebar this information, then I too can engage with you to see if that clarity is needed either in the response or somewhere else. Thank you.
Thank you, Dr. Neha. Other comments or perspectives on this one? I think it's a common aspect of metals toxicology that the valent state at the site of the many sites of toxicological action is difficult or not impossible to measure. The dosed valent state, target organ valent state, poorly known. I know we talk about that in the document. I think comments like this are an opportunity to maybe do some internal linkage of the document to previous sections. But I know that we did bring up that issue. All right, well, let's see, move on to the next one then. Let's see, this is the line 22, comment B. The Secretary Science Advisory Board document contains some statements regarding the MOA for occupational Chrome-6 induced lung cancer that are not consistent with several scientific bodies, including IARC. You've heard from Jamie on this already under comment number 2, and Dave Dorman, who said he was familiar with the way that IRC does their characterizations. Let's start by Jamie and have me asking Jamie and Dave, is there anything different here in this question than what's been covered already in the discussion of comment number 2?
Yeah, this is Jamie DeWitt. I don't think so. I think that our conclusions and the information that we include are indeed consistent with what other agencies have said with respect of the MOA for hexavalent chromium.
Miss Dave, and I think, except for maybe the comment regarding that I brought up earlier that we've already resolved, so I don't see this as a problem. We could move on.
Okay. Other perspectives? Anybody else on the board have a different perspective to share than that, which is that this one's been covered previously? All right. Note that a lot of the comments from this particular source seem to focus on the epidemiological exposures air route wise, which I don't recall being a significant foundation of our recommendations, which focused on oral exposures. So maybe that's something to clarify as well as we go back through the document one more time. Let's move on then to the last couple that were flagged as needing our attention because they appeared to be calling an error to our attention. This will be line 38 from the spreadsheet that was sent on the 24th. And I will just leave the question and a little bit of homework here for a bit, let people read it. So I'll note that in the write-up of the NTP study, each of those micronucleus assays was discussed individually. So the comment is, there's more detail than the comment that's here, that's already provided in the document. There is a focus here on our characterization of those as mixed. But the granularity for positive, negative, and equivocal are stated directly in the document. What is added is our characterization of those as mixed. So, Jamie, how would you propose we handle this? And that'll give other folks a chance to respond to a path forward.
We could explicitly state that the National Toxicology Program concluded that the results of their 4 micronucleus tests were mixed. So we could indicate that that statement came from the National Toxicology Program rather than it being our interpretation of those studies.
Mm-hmm. Yeah, thank you. Perspectives on that as the path forward, clarifying where the language actually comes from.
Yeah, I agree with that. I would just say, just add that as a quote. Put that quote as a quotation.
So does that capture it? I use this as a direct quote from their report as opposed to our characterization of the report.
Yes, I think that's appropriate. This is Jamie.
Other perspectives on this one? Concurrence or a different take on it?
Okay, Tom, even though we'll put it as a quote, I think the reference is still needed.
I agree. We will quote it. We'll use it as a direct quote with attribution.
Thank you, Tom.
Thank you. Others? right, that one seems fairly straightforward. And now we're on line 40. I think there's only 2 or 3 left. Line 40, I'll leave the comment there. It's a long one. The clarification is short, but I'll give people a chance to read that. So this is Tom. I'll call people's attention to the comment indicated that the section required clarification. Just a little bit of background that we discussed all of the drinking water micronucleus assays in the previous section to this, those that were in the NTP report and a couple of others. So the drinking water exposures were covered separately than the gavage studies, and the gavage studies is the comment that we're on now. And anybody who wants to share a perspective on the path forward on whether or not a clarification is required or beneficial, now would be a good time to share it.
So this is Dave. The one comment I would make is the last sentence in our explanation. Although gavage is well accepted, I think the bigger point is it's accepted in the context of hazard identification. It's less useful in really dose response in some ways, because as the person indicated, that there are problems with respect to dose rate. But I think, again, we could just clarify it for hazard ID. It's still relevant.
Yeah, this is Elena. I would agree with that point.
It's more valuable for hazard characterization than what?
Then dose response characterization, or just say it's valuable for hazard characterization. That's really, and it's relevant for that reason.
Thank you, Elena and David. Other perspectives on this one? All right, I'll move us to the next one, which is another long one. For anybody following on a separate spreadsheet, we're at line 48. And I'm going to go on mute to give people a chance to read the comment, as well as Gina's summation, and then I'll, in a minute or so, call on Gina to give us a paraphrase of what she found, and then also maybe the suggested path forward. All right, Gina, do you mind telling us what you would suggest as a path forward?
Okay. It looked to me like there were two comments in this one comment. The first being that it did not appear that the Science Advisory Board had considered a well-recognized biological process. And I think that we did. And in the article, Kermit et al. 2013 that we reference in our document, it talks about the chromium reduction and lists several uncertainties, which I listed a few in there. Don't know that it's relevant to necessarily do that, but I put a few from that article just to show that there were still uncertainties, as we had said in our document. The second part of their comment seemed to focus on correcting a particular statement about if dose is overestimated, risk will be underestimated. And unless I'm reading that statement wrong, I didn't see a need to correct that sentence. It sounded right to me that if the dose is overestimated, the risk will be underestimated as well. So maybe I'm reading that incorrectly, as I assume most of us would have been, but that was kind of my take on that.
Thank you. Any questions for Gina, who did the homework on this one, or any perspectives on a path forward for what, if any, changes would need to be made in a revision? So Gina, do you think this needs to be revised or just add some granularity?
If the sentence about overestimating dose, underestimating risk is confusing to those who read it, then there might perhaps be a way we can tweak that sentence. I think I put one at the end of my comment. It didn't change what the sentence said, but if there's a way to make it more understandable, I think that's okay. Otherwise, I don't know that we need to make any changes.
All right, thank you. With that specificity of this suggested last sentence as a potential modification, how do board members feel about adding that as a clarifying statement?
Tom, this is Tom Starr. Just to comment briefly on that last sentence. I think the answer to this question depends on how the dose is being used. If it is actually being used to fit a model to a given risk at a given exposure level in terms of administration, then the risk is fixed by the data. And to overstate the dose would give you, for example, in a linear model, a smaller slope factor if you overstated what the dose was. But when you're using it to extrapolate risks to other exposure situations, if you overstate the dose and you have a given slope factor, then you will be overstating the risk at that dose. So I think whether you're extrapolating or predicting as opposed to fitting, the answer changes. I'll summarize again. If you're trying to fit a given risk with a model using a dose and you overstate what the dose is, and if it just the simplest model would be linear, then the slope factor that comes out of it would be understated because you've overstated the dose for a given risk. But if you're trying to predict, overstating the dose would give you an overstatement of the predicted risk.
So this is Dave. Since we didn't do any extrapolation modeling at the tissue dose level, just for clarity's sake, is this sentence that they're referring to on page 8 in our document even needed? In other words, like getting into the weeds of whether or not it's health protective or not. I mean, we're trying to develop a number for chromium-6, and I'm not sure that that sentence that the EPRI refers to is actually provides any additional clarity for our document, to be honest.
Thank you, Tom and Dave. Tom is suggesting ways that we could clarify whether we're talking about the modeling or predictions that come from modeling. I think that could be helpful if we decide to retain it. And Dave is suggesting that it may be detail that isn't necessary for conveying our recommendation. Other perspectives? And again, this is just to guide a revision that you all will see next month. So feel free to share ideas as well as suggestions.
What does the sentence actually read in the document, Tom? Can you quote it for us?
I believe it's the one here.
Which one here?
I'm sorry. I'm speaking to my screen, but
oh, I see. I see. So it's basically
line 48B or cell 48B, and I think it would be in the presence of uncertainty concerning target tissue concentrations of Chrome-6. It's health protective to assume that the entire amount reaches the target tissue organ is the most toxic form.
Yeah, that's in a predictive mode. Yeah, and I agree. That would be fine to leave as is, or you could take the whole thing out.
At page 8, that's early in the document. That's a section on toxicokinetics, some general discussion of how Chrome moves and what we know about it, and who's done modeling, toxicodynamic or toxicokinetic modeling. It's not a section of the report where we're interpreting data yet or making recommendations. It's fairly early.
Well, if it refers to the modeling exercise, then the statement is not correct, because the risk is given, and what we're trying to do is understand what the slope of the dose-response relationship is. To state the dose, we would be stating that slope factor. I agree. Dave Dorman has a good point that we could probably drop this sentence altogether. Health protective arguments come up later on anyway, right?
That's correct.
Yeah, this is Elena. Given that our original charge was really to comment on whether the weight of evidence supported a mutagenic versus other mode of action, I think maybe it could be just dropped.
Thank you, Elena. Anyone else? When we prepare a revision, we can see about whether dropping it leaves as creates any concern with the sections right before or right after, the sentences right before or right after. If they don't, then that might be a good reason to take it out if it's not value added. Does that sound like a productive path forward? Just suggest that we delete it unless it's needed for context, in which case then we can add the points that Tom made. Any last perspectives on this one? That's what we'll do for now, is go back and look at the context in which that sentence is used and see if it's at all an important anchor sentence for sentences before and after. Otherwise, we could delete it. And this is the last one, which is that was flagged at the last meeting. This comes from a different commenter. We're at line 56, cell B for the comment, and then C for the homework. All right. And any board feedback then on this last point? The homework here indicates that we did suggest earlier in the document prioritizing the NTP assays and then proceeded to describe the results of those assays. So I don't believe this one is suggested for any change, but it's open for discussion. And we can close this one out by just having me ask, does anybody have any concerns with leaving it as is? Okay, well, I warned you at the outset that that portion of going through comments was going to be tedious. I appreciate your feedback on the comments that we flagged, and I particularly appreciate the work that Gina and Jamie did to facilitate that. The path forward will be that I will coordinate with the agency leadership to see in response to Vinny's question, what level of responsiveness summary should accompany this. You will see next month a revised document for review in preparation for hopefully a vote at our December meeting. If you have any suggested edits between now and then, please send them to me. And with that, I will suggest also that since the document's coming around one more time, it would be an opportunity to address the comment that we had as a sidebar on the intersection of science and policy, and any clarifications that we can put with that. So any closing comments or questions from the board on this section of our agenda today, which is the teeing up of a revision for hexavalent chromium before we go to break? Any last thoughts on hexavalent chromium or any questions on the path forward? Then let me ask before we go to break of Peter, our host, is it more efficient for people just to log off and log back on, or simply put their screens on mute and stop sharing until we regather again in an hour?
Either way, I'm going to pause the recording.
All right.
Personal choice.
All right. Well, thank you for a productive morning session. I look forward to seeing you at 12:30 for the afternoon session, where we'll tackle a new topic of investigating together the best ways to address the thousands of PFAS chemicals in the environment. We'll have a guest speaker joining us and an opportunity to dig into that. Thanks for a productive session this morning, and I'll see you in an hour. In response to a request from the agency senior leaders, do an introduction to this new topic of the challenges and approaches for regulating PFAS chemicals as a class. And if I had to make a subtitle for it, or to say it a different way, it would be exploring how we best address the many PFAS compounds we find in the environment. It's a complex topic that we're going to explore over the next couple of meetings. Importantly, there is not yet a formal charge. This is an exploration together, and it's conducted in light of some of the things that you see there. There are certainly published perspectives that chemicals vary too much to be lumped, in addition to publications, including those that I shared on potential grouping approaches. Some other sub-bullets there that underline the issue is that we typically work on a chemical by chemical approach, gathering all the data for particular chemicals, transport and fate in the environment, its disposition in biological systems and toxicological effects, and then draw conclusions in that way. This board, though, has done at least some grouping in December when we approved the use of EPA's grouping of PFOA and Pfas as two chemicals under one action level. So there are divergences from our typical approach. There's certainly a variety of proposals for how some groupings can be done, including the papers that I shared. But again, a big challenge for us moving forward is how to make sure that we can provide evidence-based health values. Ultimately, though, we're advising the agencies, and so this is teed up at their request to explore the issue together. The approach that we're going to take is to review some of the papers that I shared in March and April. I shared some on Gen X, and I shared several on mixtures toxicology, and that's because although we have no formal charge, this issue was among the initial technical challenges brought to our attention when we were initially chartered. And we also mentioned the need to make progress on PFAS mixtures in our recommendation section of our Gen X comments. So the papers are there for reference, and the rest of the path forward is going to be a presentation at 1 o'clock today from Ian Cousins, who's the lead author of one of the papers that I shared. The next time we get together, we're going to hear from Steve Sliver, who's the executive director of the Michigan PFAS Action Response Team. They recently went to a chemical by chemical health goals approach for several more individual PFAS rather than groupings. And if you need other papers or other speakers, I'll be glad to arrange those until we either develop a charge or decide that we've done enough sharing to raise awareness of what the different approaches are for consideration. Just for example, in addition to Dr. Cousins from academia and Steve Sliver from government, when I reached out to people to find out who might be good orientation speakers on the topics of groupings, Robert Buck came up as somebody else that we may want to hear from, who has a long history as a technical fellow at the Chemours Company, formerly DuPont, and as a doctorate from our own UNC, and his 2011 paper on the chemistry and terminology for PFAS chemicals that's been cited over 1,400 times is maybe somebody that we would want to talk to so that we can have heard from academicians, government folks, as well as industry perspectives. Our goals for today then are to share perspectives both on the papers that talked about approaches, as well as perspectives that we'll hear from the speakers and each other. And although we don't have a charge, I think what we will close with, at least what I think a productive path forward would be, is to hear from board members what other information would be helpful, any other speakers, any other papers, any other synthesis, as we explore the topic at the request to tee this up from the agency's senior leadership. That I think would be a productive outcome. And I should say that I won't limit that to hearing from the board on what other information you'd like to have. The board serves the agencies, and so any of the agency staff that have requests for additional speakers or information, let me know and we'll try to chase it down. Before we move into a discussion on the papers that I shared in preparations for Ian Cousins, I'm going to invite any of the agency leads that would like to add anything to do so in terms of what they hope to get out of this session or the one in December. So I'll leave it open for Sheila, Zach, Virginia, or anybody who might want to say what they're hoping for this and any direction that they have for board members and what I've given them, which is to ask questions, share perspectives, and then ask for what else we can provide.
Chairman Augsburger, this is Sheila. For some reason, my camera is no longer working, so thank you for the opportunity to speak. I think you've done an excellent job kind of teeing up the purpose of the discussion, and I don't have a lot to add. I do think that as we continue to learn more about these chemicals, I do think it's we should keep an open mind to see how best to provide health advisories as well as regulatory standards for them. So I look forward to the discussion and certainly come to this topic with an open mind. So thank you, though, for your leadership.
Yeah, you're welcome. And I'll note, and we'll see if DHHS has any perspectives to share, but while they're preparing for that, let me just share this slide. Are folks able to see this one? It says,
yes, we can see it.
Okay, thank you. Dave Dorman shared this with me last week. This is a free virtual workshop at the end of the month. I can send around the link to access it, but it's also quite easy if you were just to Google the federal government human health PFAS virtual workshop. It'll come up with a relatively easy link to click on to enroll yourself. And it looks like they'll be exploring some of the same topics we will. So let me pause and see if the HSS has any framing comments as we begin our exploration of this topic.
Tom, this is Virginia, and everyone, thanks for the discussion today. And I agree with Sheila. I think you've framed things pretty well as a starting point. You know, I will just say that, you know, just to kind of reiterate the point that we certainly acknowledge the challenge of going compound by compound with PFAS. But also just given the limited health data, we also see a big challenge in regulating or setting advisory levels for PFAS as a class because we don't have health data for PFAS as a class, you know? So anyway, just kind of reiterating those challenges, which you already touched on in your slide, but that's the piece that we think about a lot on this topic. And so I look forward to hearing more, you know, over the next couple meetings and learning more about it and hearing from the experts on the panel, you know, our panel as well.
Thank you. So with that, then, I'll ask a couple of things. It would help me if Peter can be on the lookout for Ian Cousins for when he joins. We don't expect it until 1, but at 1 we'll hear a presentation from him on the paper that I shared, which had, I think, 8 different potential ways of classification depending on what the end desired need of the grouping application was. And as long as we're on the lookout for Ian, I will open it up for discussion from the board on either the papers I shared, for which a couple of board members are co-authors and could certainly provide some answers. So the floor is open.
Hi, this is Jamie Dewitt. I'd just like to make a quick suggestion, if that's okay.
It is. I had put myself on mute, but go ahead.
So in Dr. Cousins' grouping paper, he has a table, and that table is table 3. And within that table, there are 4 different U.S. states listed that have used a grouping type approach. I'm wondering if it might be helpful for the board to hear from a representative of one of those 4 states, and those are Connecticut, Maine, Massachusetts, and Vermont. I would encourage us maybe to consider Massachusetts or Vermont because they use a slightly different approach to grouping the PFAS that they've grouped than did Maine and Connecticut. And these are approaches that are based on similarities in toxicology or toxicity of the PFAS. I think it might be interesting to hear their rationale.
Okay, thank you for that. Questions from others on papers that were provided, especially considering we have a couple of co-authors on the panel, or additional questions or suggestions for path forward, like Jamie's, in terms of other people that you'd like to hear from or information that you'd like to have.
This is Jamie again. I have another suggestion for a paper that we all might want to review. It is, and I am happy to share it with you, Tom. It is a paper that was authored by Gloria Post. She is from New Jersey, and she's with their Department of Environmental Protection. And her paper is the result of the Society of Environmental Toxicology and Chemistry PFAS topic-focused meeting. And this is in environmental toxicology and chemistry. And her paper describes the evolution of PFAS standards across different states. And she goes over some of the reasons why some values in one state may differ from values in another state. So it's a really insightful paper in terms of helping us get to the bottom of why states may have variability. And then she talks a little bit about that variability in her paper. And I'm happy to share a copy of it with you. I have a copy of it. It's also available online.
All right, thank you. We'll make sure that that's included in a follow-up mailing. Others, perspectives, information needs?
And this is Detlef. Maybe a topic that's related but not solely in the PFAS realm is the question of how to deal with mixtures. And there's some interesting recent work, mostly focused in the area of disinfection byproducts. People are studying in vitro assays for cyto and genotoxicity, and they look at the question of what is the toxicity of individual compounds and what is it then in the mixture. And in this case, the results appear to suggest that an additive approach is quite appropriate for the disinfection byproducts. And I'm just mentioning it because it is a conundrum that seems to have there's a very practical need for thinking about the mixtures, and I thought it was interesting that progress is being made on that front. So the researchers in that area, there's Bill Mitch at Stanford University and Michael Pleva at the University of Illinois.
Thank you, Detlef. Certainly, toxicology of mixtures literature, if we expand it beyond PFAS chemicals, is robust. I guess in reading Dr. Cousins' paper, one of the things that jumped out at me was how many of the different potential grouping mechanisms are purpose-driven, and some serving a purpose that others wouldn't. There can be groupings that are done for regulation, or groupings that are done for just prioritizing analytical chemistry in environmental samples. Quite different approaches for quite different endpoints. Perhaps if we proceed to a charge or get closer to a charge, a way to refine what information would be useful would be to talk more about, well, what's the desired application? What's the end game or games for which the groupings could potentially be considered? Thank you, Detlef. There's more information to share for sure on that topic. Others?
I'd like to just ask a question since we have a few minutes. A concept that I wasn't familiar with, and I don't know if anyone on the board could comment on this, but basically the idea that PFAS can bioaccumulate, and in doing so, they can reach concentrations that may be hazardous, even if you're not exposed to what would be considered hazardous levels. And that was kind of a new concept for me, and I just didn't know if anyone had any comments on that consideration.
This is
Jamie,
JP. I might have a few comments.
Sure, go ahead, please.
So I think there's a really good paper that you might want to read, and I'm happy to share it with the board. It's by Pachowski et al. And this is a paper that outlines the New Jersey's approach to deriving a reference dose for PFOS. It happens to be based on immunotoxicity guidelines, which as an immunotoxicologist pleases me. But what's nice about this particular paper is that they go through some of the rationale for selecting a target human serum concentration for the reference dose rather an external dose. And this is all based on the slow clearance of PFAS from humans relative to other organisms. And so it sort of answers your question that we really need to be looking at the internal dose concentrations as opposed to the environmental concentrations or the administered dose concentrations from animal studies because of the difference in half-life between humans and experimental animals, with the assumption that humans excrete these compounds much more slowly and are more likely to build up an internal concentration that will induce toxicity based on the concentration at a site inside of the body that can be associated with toxicity. And I'm happy to share that paper. It's a really nice example of that thought process.
Thanks, Jamie. Yeah, I'd appreciate that.
Thank you, Jamie. Any other perspectives on Virginia's question or observation? When we did the Gen X work, I was trying to recall whether or not there were a prioritized list of compounds that would have come after that, in addition to the want to address mixtures. Was there a list at all queued up at that time of additional compounds for which maybe perhaps federal guidelines didn't exist and local guidance could be helpful? Do folks recall that? Because in addition to a grouping or mixtures approach, there's also the approach of evidence-based individual standards for additional compounds like we did for Gen X.
I certainly defer to others who were here at that time, but my understanding is that we don't have that list, although it might be good to develop a priority list. In our internal discussions, that's been something that we've, considered whether, it could be an ask for something that the SAB would help to, advise on. So anyway, we have considered that before, so I don't think we have that list, but maybe others have more information.
Virginia, this is Sheila. You're correct. We have not developed a list. I think it would be helpful to maybe look at all of the data that has been collected since the board looked at the appropriate provisional drinking water goal and see which of the compounds are most prevalent in North Carolina's environment. So I think that maybe that is another area where we can present data that's been collected both by the state and researchers such as Dr. Knappe and others. And that would be another presentation that would be helpful to the board as they consider this issue.
It certainly might help with examining the different potential grouping schemes that we'll hear some about today to know what the compounds of most interest are and weigh groupings against that shorter list than all possible PFAS compounds. Other perspectives on that with regard to individual chemical priorities?
This is Detlef. I just wanted to say I agree with the approach that occurrence can drive the priority list, and so I'm happy to speak on that from the perspective of the findings of the PFAS testing network.
Great, thank you. I think that would be helpful. We could probably also add that to the presentation from Steve Sliver with Michigan, as they recently did about a half a dozen of additional compounds, derived health goals for those. And Jamie was on the task force that helped with the report that was useful in recommending those to the state of Michigan. Jamie, do you know how they came up with their prioritized list of additional compounds?
So so I was on the science advisory work group that was advisory to the MPART, and I'm sure that Steve will talk about that in December. What we did is we looked at the PFAS that were tested for, and they followed some of the EPA methods. And then we looked at those compounds that were detected. And I think Gen X was the one exception of the compound that was retained for the derivation of health-based value because it was an emerging PFAS of concern in other states, for example, North Carolina. So it was mostly based on what compounds were present. And then they moved forward that way. So it was occurrence in the environment as opposed to biomonitoring efforts. And I don't think Michigan has a lot of biomonitoring information.
Was there a step somewhere along the way between occurrences and preliminary information on like relative potency or toxicity to add a toxicological component of relevance, or just based on occurrence?
I think it was just based on occurrence. I would have to go back and look at my notes, but I believe they did occurrence. And then for some compounds, they developed screening levels to do some additional evaluation, perhaps in private well water. And then they came up with their recommendations based on what other states had done. So we didn't derive reference doses from scratch. We looked at what other states had done and then made our own scientific decisions in terms of uncertainty factors, modeling approaches to use to come up with those values that ended up being maximum contaminant levels. And the job of the science advisory work group was to work with the state to make recommendations. We did not exactly tell the state that they had to accept our recommendations at all.
I see, thank you. As people reflect on the papers that were provided and the presentations that are teed up, in addition to the papers that we said will be coming, and trying to get we'll take Detlef up on the offer to go through occurrence information for PFAS in North Carolina as a step maybe in either identifying individual compounds for evidence-based health goal derivation or potential groupings. Any other information that comes to people's mind that they'd like to have early on in this exploration. All right, well, I'm going to pause for a minute and check with Peter. Do you know if Ian has been able to join us yet?
Yes, and I just made him a panelist, and I will
Perfect.
make him the presenter.
Ian, are you able to hear us? I wasn't able to hear you.
Yeah, I can hear you.
Okay.
Can you hear me?
I can now, thank you.
Yeah. I don't know. Let me see. Okay, now I've got different options coming up.
Well,
Okay.
share your screen and I'll give you a brief introduction once you're able to share your screen.
Yep, I will do that.
And take your time. We know that you're joining us at the end of a long day already.
Yeah, that's okay.
And for that, we're appreciative.
I'm just trying to find out how to do this because I've never used this before.
On my screen, it was near the bottom.
Okay, yeah, I can see.
There you go.
Yeah. Does that work?
It does, but it's showing us the presentation mode as opposed to the full screen.
Oh, well, okay, I'll do the normal one.
There.
Sometimes you can do the presentation screen so that you can see the notes at the same time, but the audience don't see it, but that didn't work on this system.
Well, thanks so much for joining us. Dr. Ian Cousins is a professor at Stockholm University with expertise in approaches to investigate the sources, transport, and fate and exposure of organic pollutants. He's published more than 150 peer-reviewed articles in 10 book chapters. And in recent years, he's focused on the per and polyfluoroalkyl substances, which are our topic today. I shared your 2020 article on grouping strategies with a helpful figure that talked about from general to very specific and how the different strategies are basically built for different applications. It depends on what the end use is. I shared that with the board members, and this is our introduction to the topic. It's certainly the board's historic practice to go chemical by chemical, but we realize it's a daunting challenge. We appreciate your time with us at the end of your busy day already today. And if you have a half hour to share for your presentation, I hope you'll leave some time for board's questions and answers.
Yeah, thank you very much for inviting me.
You're welcome. Thank you.
Yeah. So yeah, as you said, my name's Ian Cousins. I'm working at the Department of Environmental Science at Stockholm University. You might be able to tell though that I'm not Swedish. I'm originally from the UK, from the south of England. Yeah, today I'm going to talk about grouping strategies of PFAS. And as you know, we published on this, so you can read the paper if you want more details. So the outline of the talk is I'm going to talk a little bit about definitions of PFAS and terminology. And then I'm going to talk about strategies for grouping PFAS. I'm going to finish with some take-home messages, and hopefully then we will be able to have a discussion. So I think it's quite important to understand what PFAS are, and to understand that you have to know the definitions of what a PFAS. And the first definition of PFAS actually didn't come about until 2011, and it's in this publication by Bob Buck et al. And it's really the first class definition of PFAS. And it's I don't really want to read out the whole thing. But basically, the highlighted texts are important here. The highly fluorinated aliphatic substances that contain one or more carbon atoms, and these carbon atoms should be fully fluorinated. So basically, anything is a PFAS as long as it has this moiety and this chemical formula CnF2n plus 1. For a chemical to be a PFAS, it must at least have this CF3 group in it. And this actually means that an awful lot of substances are PFAS. A wide range of different chemistries can be classified as PFAS. More about that in a minute. And then in the US, you have this Interstate Technology and Regulatory Council that has also a definition of PFAS. It basically follows the same definition as Buck et al., but the only difference is that it says a PFAS has to be a substance that has at least 2 fully fluorinated carbons. So it has to have this moiety, at least this moiety in the structure, CF3, CF2. And then there's work underway to make the definition even broader. So the OECD, they want to make the definition of PFAS the fluorinated substances that contain at least one aliphatic fully fluorinated carbon moiety. So that substances are PFAS if they have at least one CF2 moiety in the structure. So that broadens the definition even further. So what you end up with is an awful lot of substances that can be PFAS, and lots of these are probably unknown to most of you. I think we all know the well-known PFAS like Pfas and Pfas. But if you look at the whole universe of PFAS, you end up with a wide range of different structures. And you may be familiar with the OECD list, where they identified nearly 5,000 different CAS numbers that are PFAS. And they're including aromatic substances and some of these dicarboxylic acids that we see on here. And they range from small to very large structures, from non-polymeric substances to polymeric substances. So we really are talking about a wide range of chemistries here. So So just to highlight this, we have many thousands of structurally diverse substances, and they're in use in society. So these include polymers and non-polymers, neutrally charged and anionic and cationic and zwitterionic. Zwitterionic are substances that have both positive and negative charges on the same molecule. They're solids, they're liquids, they're gases. Some of them are reactive, and some of them are entirely inert. Some of them are soluble, some are insoluble. Some are volatile, some are involatile. Some are mobile, some are immobile. So you basically get the picture here. They cover the sort of full range of properties. They're bioaccumulative and non-bioaccumulative. Some are highly toxic and some are relatively non-toxic. For example, of a fairly non-toxic PFAS are these fluoroalkanes or fluorocarbons, which are basically hydrocarbons where all of the hydrogens are replaced by fluorine. These are highly volatile substances which are used as refrigerants. They're not likely to be absorbed by humans or wildlife, but they are powerful greenhouse gases, but they're not toxic like something like Pfas or Pfas. So I think one of the things that concerns us about PFAS is there are a huge range of different substances, and actually there's very little information about most of them. If you want to sort of characterize whether they're a problem or not, there's very little information on their uses, their properties, and so on. So there is a concern just because we know so little about them. So what are the common features of PFAS that make them so useful in society? Well, they have high chemical stability, and that's due to the strength of the CF, or the carbon fluorine bond, which is often called the strongest bond in organic chemistry. And when you have multiple fluorines on the same carbon, actually the bond gets even stronger. So it is basically an unbreakable bond, which makes the stability of the molecule extremely high. The other thing that makes these chemicals very useful is that the fully fluorinated carbon chain has both hydrophobic, that means water-hating properties, as well as oleophobic, that means they hate fat as well. And this is basically unique for this kind of chemistry, that they can repel both water and fat, which makes them very useful in surface protection because they can repel both water and stains. So yeah, they're useful as fluorosurfactants. These typical asymmetric molecules that have a polar head and a hydrophobic tail, and they're very, very powerful surfactants. They can lower the surface tension of water to 16 millinewtons per meter, which is half compared to hydrocarbon surfactants. And they're very good surface protectors. They have very low surface energies compared to hydrocarbon-based or silicone polymers. So, and they give simultaneous water or oil and stain repellent. So that's why they've been used so widely in society, because they have unique properties and they're very useful. We tried to work out, actually, I think we're all aware of the well-known uses, like in firefighting foams, in non-stick frying pans, waterproof outdoor clothing, and so on. These uses are well known, but there are many uses which are not so well known. So recently we've been trying to determine what all of the different PFAS are used for, all the different uses of PFAS. And we identified 200 categories and subcategories of uses of PFAS for more than 1,400 different PFAS. So it was quite a lot of detective work to try and work out all of these uses of PFAS. And some of the sort of well-known ones, and actually the ones that come up as the highest use volumes. So the actual highest use volume was the production of plastic and rubber. When you make most non-fluorinated plastics, you use fluoropolymers in the extrusion and molding process. So this is a very common use of PFAS. Also, in the electronic industry, this is a non-polymeric PFAS are used widely in the electronic industry. So, I mean, all of your electronic equipment, everyone has a cell phone. There are actually multiple applications of PFAS in your cell phone, including the electronics in there, but also the screen protection, the fingerprint proofing on the screen, and so there are many applications. So, you know, we discovered quite a lot of less known uses in ammunition, climbing ropes, guitar strings, artificial turf, soil remediation, tennis rackets, etc., etc. I mean, you can read this. This is already available online if you're interested in all of the multiple uses of PFAS. They really are very widely used in society, as well as the well-known uses. So I want to talk today about the strategies for grouping PFAS. And this is what was the subject of our paper as well. So I'm going to basically summarize the paper that we wrote. Well, we decided that grouping strategies are needed for PFAS because it would be too time and resource intensive to test and regulate the more than nearly 5,000 PFAS on the global market on a chemical by chemical basis. So we've kind of looked at the available grouping strategies. Not that we came up with new grouping strategies. We sort of reviewed the grouping strategies that would be available. And I can divide these grouping strategies into two, basically. Firstly, they're those that are based on the intrinsic properties of the PFAS. And secondly, they're those that inform risk assessment through estimation of either cumulative exposure of mixtures of PFAS or cumulative effects or mixture effects of PFAS. So I'll start with the intrinsic property approaches. So this approach is called the P-sufficient approach, and it's based on the fact that we know that all PFAS are very persistent, and they're persistent under the what I would say is the European definition of persistent, or the European Union definition of persistent, which means that a substance is persistent if it's either persistent itself or when it degrades into highly persistent transformation products. So some PFAS are actually reactive, as I mentioned earlier, but they always pretty much degrade into substances which are stable end products. So there are many precursors of PFAS and PFOA, but when these precursors degrade, they form PFAS and PFOA as the end products. And basically, this is a property of all PFAS. So they're all extremely persistent under this definition of persistence that we have in Europe. And a substance which is highly persistent, I should also mention that they're synthetic substances, so they shouldn't be in the environment. And persistent substances ultimately accumulate in the environment. So over the long term, you have an accumulation, and the concentration basically goes up. If you have a steady input of a highly persistent substance, there's no actual removal mechanism for that chemical from the environment. There's dilution and burial, basically. So ultimately, there are areas in the environment where you get an increase in concentration. And when you have an increase in concentration, it basically means that you'll eventually reach some kind of effects threshold. Now, eventually, I mean, it might take a long time, but you will eventually reach an effect threshold. It might be a known threshold, or it might be an unknown effect, something we haven't actually studied yet, but you will ultimately reach something. So the idea of this is that this paper is basically that very high persistence, the property of very high persistence that all PFAS have is a problematic property because you will have accumulation of these chemicals over the long term, and therefore their use in society is really not sustainable. So this is the idea that you have one property that's common for all PFAS, and we can use this for grouping PFAS. Of course, there's no legal basis for this kind of regulations. That's the big drawback with this kind. It's kind of nice conceptually from a scientific point of view, but from a regulatory point of view, legally, it doesn't really work because there's no, this hasn't been used before in chemical regulation. But there's definitely a lot of interest in this idea in Europe, and hopefully the concept will spread around the world a little bit as well. Another way of grouping PFAS would be to combine persistence with their bioaccumulation. Now, this is also quite commonly done in Europe. We regulate chemicals quite often if they're very persistent and very bioaccumulative. And this is how sort of the long chain PFAs have been regulated, the perfluoroalkyl acids in Europe, because they are both persistent and bicumulative in wildlife and in humans. They're very slowly eliminated, so they accumulate in our bodies. And it's well known that these chemicals like PFAS and PFOA have these properties, but also some of the other chemicals in those classes, the perfluoroalkyl carboxylates and the perfluoroalkane sulfonates. The long chain chemicals in that class we know are bicumulative and persistent. But there are many other bicumulative PFAS out there that are also persistent. And we're starting to discover them. And on the right, you can see some of them where as analytical techniques develop, we're starting to identify some of these substances. And I think we should be able to identify more of them because they have they have common structural features. In particular, note that almost all of them have at least 6 fully fluorinated carbons. So there are techniques that we could use for identifying more of these bioaccumulative substances. There are techniques like in vitro protein binding, for example. And so we're starting to identify more of them. So this could be another basis for regulating intrinsic properties, combining the persistence with the high bioaccumulation potential. In Europe, there's an idea that's come about. It was largely developed by the German Environment Agency. They proposed this idea of persistence, mobile and toxicity, or very persistent and very mobile substances as a way of sort of grouping problematic substances. The idea is mainly to protect threats to drinking water. So we know that some of the short chain perfluoroalkyl acids and some of the replacement chemicals like the Gen-X chemicals are accumulating in drinking water, but they're not traditionally considered to be bioaccumulative substances. They're highly persistent, so they will accumulate in drinking water and their concentrations will go up, but they're relatively rapidly eliminated from humans and also from wildlife. So they wouldn't fulfill the bioaccumulation criteria. However, so this is why the idea came up, like, well, we should come up with a new criteria for persistence and mobility, and it's based on how strongly a chemical absorbs to soil. If it doesn't absorb strongly to soil, then it's considered to be mobile and will enter drinking water. So there are cutoffs based on what's called the octanol water partition coefficient or the organic carbon water partition coefficient. And what basically happens now is that we cover an even wider chemical space. So we have the bioaccumulative substances, and we have the mobile substances, and these usually aren't the same kind of substances. So if you combine both the mobile substances and the bioaccumulative PFAS, you basically cover almost all PFAS. The only PFAS that you miss actually are the volatile PFAS that you will find in the air, things like the perfluorinated alkanes that I mentioned earlier. Yeah, and so industry have also come up with another idea for grouping or degrouping a class of PFAS or a subclass of PFAS from the other PFAS. And one of the reasons for this is because fluoropolymer products are extremely important, for the fluorochemical industry, because they are basically the major means for them to make money. That's what they make most of their money from. So it's very important commercially for them. As you also noticed from the uses slide, this is one of the major uses of fluoropolymers, of PFAS. It's in the fluoropolymer products. So there's a paper that came out, you'll see at the bottom here, by Barbara Henry, who works for Gore, which is one of manufacturers that actually make a lot of fluoropolymer products, for example, medical devices, but also Gore-Tex, which is used in waterproof outdoor equipment. So you can see there's an interest here to sort of degroup these fluoropolymers, and the reason they say that they should be not considered the same as other PFAS, they call them polymers of low concern, is because they will not enter the human body or wildlife, because then they'll be assumed to have low bioavailability because they're very big molecules. They also now say that modern fluoropolymers now don't have any impurities in them. So they're completely, basically, very large substances, very inert substances. They will never degrade, but neither will they enter humans or wildlife and cause a problem. So in their view, they should be considered, fairly harmless substances and not be considered like the other PFAS. But of course, you people who work in or live in North Carolina will know that the whole issue with fluoropolymers is not really the use phase. You have to consider the whole life cycle of a fluoropolymer. And a lot of the problems with fluoropolymers happen during manufacturing. So the film Dark Waters is all about the issues of PFOA being released in the environment as a result of the use of PFOA as a processing aid. And now there are other processing aids that have replaced PFOA that were also released in the environment. And there are hundreds of substances also released along with these processing aids during fluoropolymer manufacture. And so there are certainly concerns around manufacturing sites, and there are also concerns with what the solid waste, the end of life of a fluoropolymer product, because it's a persistent plastic, basically. How do you dispose of it safely and make sure that it doesn't enter the environment? So you have to think about the whole life cycle. So I think it's a little bit dishonest to focus just on the use phase of the fluoropolymers and forget all of the the production and the disposal of these substances. In fact, in China, they still make fluoropolymers with PFOA. So the people if you've bought your PTFE from China, then there are a lot of people in China who are getting contaminated drinking water, which is contaminated with PFOA. Okay, so now those are kind of different sort of what I would say grouping methods that are based on the intrinsic properties. Now I'd like to switch to grouping methods that inform risk assessment. So the first idea is this is kind of a cumulative exposure approach, and it's called the arrowhead approach. And it's when a representative PFAS, usually a perfluoroalkyl acid, is managed together with its salts and its precursors. And this is often how it works in regulation. So when you regulate PFAS, you don't just regulate PFAS, you regulate PFAS and all of the related substances that can degrade into PFAS, either in the environment or in organisms. So you manage all those substances together. The same with PFOA and so on. So in all these different regulations, you manage all of these substances together. But there's actually a lack of methods for measuring all of the different related substances or precursors to a specific perfluoroalkyl acid. So this method came up a few years ago. It's called a total oxidizable precursor assay, and it's a potential solution where you can measure all of the precursors that can convert into a perfluoroalkyl acid. So I mean, basically, if you don't know what the top assay is, basically you analyze the perfluoroalkyl acids in a sample, like a drinking water sample, before and after you oxidize it with a powerful oxidizing agent. And the difference between the PFAAs before and after you oxidize is basically the sum of the different perfluoroalkyl acid precursors. So it's been developed for water, basically, but it's now being applied to other media like soils. So, for example, you could, in theory, you could actually compare levels of PFAAs in samples after you've applied the top assay, because then you take into account all of the conversion of the precursors into the perfluoroalkyl acid assay, into the perfluoroalkyl acids. The problem is that some people argue that the top assay doesn't simulate degradation and metabolism accurately as it occurs in the environment, but I think it would be quite a good screening method, and people are starting to look at it as an approach for regulation. Another idea is to use the total fluorine or extractable organic fluorine or adsorbable organic fluorine as surrogates for PFAS cumulative exposure. So we know there's a lot of unknown PFAS in a sample that we can't measure all of them because we don't have standards for them. So instead, we could measure the total fluorine or the total organic fluorine or total extractable organic fluorine. And you could set limits instead of setting limits for individual PFAS or the sum of individual PFAS. You could set a limit for the total organofluorine. And this is an idea that is actually probably going to be implemented in the Drinking Water Directive in Europe. So having a sort of PFAS total based on extractable organofluorine of 500 nanograms per litre. And it could be used, at least it could be used as a way to pre-screen samples and to determine which, when you've got high PFAS in a sample or low PFAS in a sample. Of course, there's problems with this method because there's huge uncertainties in translating these measurements of extractable organofluorine and absorbable organofluorine into risk-based guidelines, because you don't know actually which PFAS you're capturing. You're capturing basically all organofluorine, which can be non-PFAS as well. So you don't really know what you're capturing, and how do you translate that really into a risk-based guideline? In Europe, this is quite often, certainly in Scandinavia, this simple additive toxicity is sometimes used, and I think it's being used more and more in North America. So what you do is you basically assume that multiple PFAS have equivalent toxicity to a lead PFAS, which is quite often PFOS. And then you just you set a guideline based on the sum of all the PFAS in the samples. So you basically assume that all the PFAS in your drinking water, for example, would be equivalently toxic to PFOS, and then you just add up the sum of those individual perfluoroalkyl acids. And in Sweden, we have guidelines based on the sum of 11 PFAS. In Denmark, they have the sum of 12 PFAS. And this is becoming also common in US states as a kind of conservative way of protecting people from drinking water exposure. Of course, the limitations in this approach are that we know that the elimination kinetics vary enormously between the different perfluoroalkyl acids. A short chain perfluoroalkyl acid will be eliminated very rapidly from your body, whereas a long chain perfluoroalkyl acid will actually be eliminated very slowly. So can you really add them up in this way when the elimination kinetics are very different? Also, we also know that there's debate over the critical adverse effects, so that there can be different modes and mechanisms of action for the different individual perfluoroalkyl acids in a mixture, so that you can't assume the same effect. And also, mixture toxicity may not be simply additive, as is assumed in this. And of course, you're also missing a whole bunch of the unknown PFAS. But still, it's considered to be a nice conservative approach in many jurisdictions around the world now. So there are also refinements to this mixture toxicity. So there are methods that have been developed, for example, by ourselves and also by in the Netherlands. And in this approach, you still assume the same toxic effect, but you take into account the different elimination kinetics between the different perfluoroalkyl acids and then add them together in a kind of relative potency factor approach. So it's a little bit like the methods that we use for dioxins, where you add together a different relative potency factor for the different perfluoroalkyl acids. So this is another approach, but again, you have to assume that you have the same effect for all of the different perfluoroalkyl acids, which is still hotly debated whether you can assume the same effect for all of them. And of course, the least conservative or the most conservative approach, you could say, is to only group PFAS that have the same adverse effects, modes and mechanisms of action, and toxicokinetics for risk assessment. But this basically means that you might as well go back to your one-by-one assessment, because if you use this very strict basis for grouping PFAS, you won't be able to group hardly more than 2 PFAS together, and then you might as well just go back to a chemical by chemical basis for doing your your risk assessment. So yeah, there was this slide I think Tom mentioned that just kind of puts together all of the different methods and lists the advantages and disadvantages for each of these different methods. So you can have a look at the paper. So there are various challenges going forward with these grouping approaches. First of all, there's still a lot of arguments over what we should define as a PFAS, and because these definitions I showed you at the beginning are quite hotly debated. Some of them think they're way too broad and we're capturing way too many substances in the PFAS definition. And this is, of course, very sensitive because now PFAS there's a lot of talk of doing regulation of PFAS as a class. And how you define PFAS then becomes very important about how many PFAS you capture in this class regulation. It could potentially be thousands and thousands of substances, and some people would argue that a lot of these substances aren't as harmful as others. So we should in fact spend quite some effort in actually categorizing which PFAS are the ones that we should regulate and which ones we shouldn't, rather than actually lumping them all together. But the problem is that there's very little information available for most of the PFAS, which is why we end up with these kind of lumping together and saying they're all a problem, because we don't really have much information on most of them. So I would have to say that as you go around the world, of course, there's different philosophies about how you regulate chemicals. In North America, there's certainly more risk assessment paradigm than we have in Europe. In Europe, we have a more, I would say, more regulatory methods based on the intrinsic properties. So we regulate more on things like persistence and bioaccumulation. And risk assessment is something that comes in later. Whereas I'd say in North America, it's very much a risk assessment paradigm. It has been and up until now. Our own views on how to group PFAS is we really think that there should be a precautionary approach based on the lack of information of PFAS and based on their very high persistence, which we think is problematic in itself. And we think there should be upstream, what we call upstream solutions, where we try to look for alternatives to PFAS wherever possible, because we don't think all PFAS use is essential in society, and we think there are lots of safer alternatives that could be used and phased in instead of PFAS. So we should spend a lot of effort looking at how we use PFAS and how to substitute PFAS in society. But on the other hand, we already have a lot of PFAS in the environment, and for those we need more practical methods for setting drinking water guidelines, environmental cleanup level strategies, and so on. In those cases, we probably need less precautionary, more risk-based strategies, some of the later strategies that I was mentioning in the talk for tackling that issue. So that's basically what I had to share. I hope you found it useful. There's been, this global PFAS science panel. It's something that Jamie and I belong to, and all of the work that's been done has been done by scientists who belong to this global PFAS science panel. We receive funding from the TIDES Foundation for this cooperation. Thank you very much.
Well, thank you, Ian. We appreciate that presentation, the paper that I shared earlier, and your time this afternoon or this evening for you. I think it was a really good introduction to the range of approaches, depending on what people's goals are, along with the, all sides of it, the potential advantages in addressing challenges and some of the limitations. We're on a little bit of a tight time frame, but I do want to open the floor to agency staff or board members for one or two questions while we have Dr. Cousins on the line. So the floor is open.
This is Detlef. Thank you for a nice presentation, Ian. I'm curious about approaches in Sweden about, the different points where PFAS can be managed. When I think about regulations for drinking water, that's a very late stage in the process of considering a regulation for a chemical. And so the class-based approach may lend itself more to upstream considerations, whether that's manufacturing or maybe even emissions into the environment versus, a more risk-based approach for drinking water once we know what actually may end up in the environment.
Yeah, I mean, that is basically what's happening. There are several countries that are very active. So you have Sweden, in the European Union, you have Sweden, Denmark, Norway, Germany, and the Netherlands. Those 5 countries are very active in PFAS regulation, and they're putting together, what they're trying to do is put together a PFAS restriction regulation. So they want to restrict PFAS as a class. They want to make it as broad as possible. And based on the fact that they think PFAS are problematic substances, and where they're not needed in society, they can be phased out. So these regulators really want to do this, but they realistically they're up against some opposition from other people, because it's quite a long process of regulating these chemicals. So there will be a long consultation, and the industry will be involved, of course. So I think that how broad this PFAS restriction will be is going to be interesting. I don't think it will be as broad as they would like. They would probably like it to be basically the whole class of PFAS, which is an enormous number of substances. So, there are lots of powerful lobbyists that will say, for example, the fluoropolymers, for example, will be one they say should be degrouped from the low molecular weight substances. There's definitely going to be a big effort from industry to do that. So this will, I don't think it will end up being all of PFAS. But I think the real drivers for change aren't necessarily the regulators, to be honest. I think the real drive for change has been the manufacturers and small manufacturers and retailers in certain sectors. You can see very rapid change. So, for example, in the outdoor clothing sector, there's been an enormous change where there's been a lot of non-fluorinated alternatives being developed very, very quickly. And also in ski waxes, this was also very, very rapid that the fluorinated ski waxes got phased out. In cosmetics, the PFAS got phased out very, very quickly by loads of retailers once they realized there were PFAS in cosmetics, like PTFE in cosmetics and other PFAS in cosmetics. They were quickly phased out by many retailers. And so I think when those companies, there's a big movement towards sustainability. And I think that those companies actually are causing change and are pressuring the fluorochemical industry. And so I think those were the biggest. Now with the outdoor clothing, you have people who buy outdoor clothing like being outdoors, they like the environment. People who use ski waxes are also like to be outdoors and like the environment. So you can see I think there's a correlation there. So the NGOs like Greenpeace and so on had a very effective campaigns as well for getting the consumer aware of PFAS in these kind of products. So I see very rapid change and very encouraging signs in certain sectors, but I don't think not everyone is aware of how widely PFAS are used in different use categories. And this is one of the paper that I mentioned earlier. Hopefully we can educate people more about how widely PFAS are used.
Well, thank you again. This was Ian, you joined us about halfway through this topic, and this is our first session of what will be several. If there are suggested follow-up readings that you'd recommend, I'll be glad to share those with the board. Before you got on, we shared a half a dozen potential steps forward for additional speakers. We'll be hearing in December from Steve Sliver with Michigan on their compound by compound assessments and health goals for additional compounds. Detlef has agreed to help us consider a priority list of individual compounds based on occurrence information in North Carolina. And Jamie suggested some additional papers and presentations on North American grouping approaches. We do have another item on our agenda for today. So with that, I'm going to thank you again for your time, especially joining us at the end of your workday.
No worries. Thanks very much.
For sharing the nice overview of the different approaches depending on what the goals are.
Yeah.
So thanks again.
You're welcome. I'll see you.
All right.
Thanks.
Bye. That moves us to the last item on our agenda, which is the public forum. And there are 6 people who registered before the requested deadline to speak, which was important in this virtual format. And I'm just going to call on them one at a time. Of the 6, 4 wanted to speak on the topic that we just addressed, the introduction to PFAS as a class. And I'll call on them first, and then we'll close out with the final 2. We are hoping to end at 2 o'clock, so I'll ask the people that I call on for their comments to be brief, and we'll invite any more detailed interactions. We can probably tee those up at a future meeting. So we had 4 people who registered to comment on PFAS as a class, and I'm just going to take them in the order that they registered. And the first is Steve Risotto with the American Chemistry Council. Have you been able to join? And can Peter have you address us?
So hi, this is Peter. I do not see Steve on the list of attendees. There are a couple of people as attendees who are showing up as a call-in user, which meant they called in on their phone, and 1 or 2 other folks who don't quite have a full name, but I do not see the Steve Risotto.
Okay. I'll call on him again, and I'll just say for the benefit of, in case he's listening, if you want to put in a chat, or you can contact Peter. Peter is IT lead for the state helping with this call. If you're having trouble being heard, either put something into the chat if you're online, or contact Peter, and we'll loop back around. The second one was Corey Bell with the Natural Resources Defense Council, who also wanted to address us on PFAS as a class. Corey, are you on? Or Peter, do you see if Corey is on?
Corey is, and Corey has been unmuted.
Okay, Corey, we welcome your comments. And again, apologize for our time constraints in the virtual world, but you can concisely convey what you have to share with us. Again, this is our initial foray into this, so we'll be revisiting it.
Of course. Can you hear me all right?
I can, thank you.
Okay, great. Hi, I'm Corey Bell with the Natural Resources Defense Council, and thank you for the opportunity to provide comment today on this pressing issue. My comments are going to focus on the need and ability to regulate PFAS as a class. Hundreds of scientists have spoken out urging that PFAS be addressed as a class, because without such action, these chemicals will continue to accumulate and cause harm to human health and ecosystems for generations. At least 6 different articles and scientific statements signed on to by hundreds of scientists urge for the regulation of PFAS as a class, or at least in subclasses. As you just heard, it's inefficient and uneconomical to try to regulate the thousands of chemicals in the class one by one. In addition to being cost-effective, regulation of the entire class is the best way to ensure protection of public health. It is feasible to regulate PFAS as a class, or at the very least by subclasses. There are at least 6 instances of this happening in the US and abroad. For example, the EU Drinking Water Directive seeks to address the entire class, and EU's REACH addresses over 500 PFAS. There are at least 4 instances of regulating a subclass of PFAS, including examples here in the US, as Ms. DeWitt noted earlier. Regulating PFAS as a class is the only way to ensure protection of public health and to stop the problem of regrettable substitutions, which North Carolina already knows all too well because of Gen X and other substitutes. It will help end regulatory whack-a-mole, which only protects DuPont and Chemours, and results in North Carolinians' continued and unnecessary exposure to PFAS compounds. Because it is feasible, economical, most protective of public health, and also the scientific consensus, this board should urge DEQ and Health and Human Services to regulate PFAS as a class. Thank you again for the opportunity to comment.
Thank you. We appreciate you sharing that perspective. The next person who signed up to speak is Emily Donovan, joining us from Clean Cape Fear, also on the topic of PFAS mixtures. Emily, have you been able to join the call?
Yes, hi, good afternoon.
All right, the floor is yours for a few minutes. Please go ahead.
I live in Brunswick County, and I raised my children on tap water that still contains some of the highest levels of PFAS found in drinking water in the nation. We live with anxiety and worry about taking hot showers and breathing in the steam vapors. We worry about what our children are drinking at school, and we worry about what we're eating and drinking when we go out to dinner. We worry about exposures that have put us at increased risk for severe COVID or other vulnerabilities like ineffective vaccine responses. We know drinking water is not our only exposure pathway for PFAS. We've been chronically overexposed to hundreds of PFAS for decades, and we just recently learned about the existence of an additional 250 unknown PFAS that was contaminating our drinking water supply. My community is a living example of the limitations of science. We can't afford for anyone on this call to be wrong on PFAS. We can't afford for North Carolina to take a moderate approach to addressing PFAS. The EPA recently said there are over 8,000 PFAS, and every day it feels like there's a new discovery of yet more PFAS. We know the carbon-fluorine bond is completely unnatural and a 100% human-made technology. And personally, I feel we have no business making a chemistry that has no proven safe disposal method. The lack of a proven safe disposal method combined with the persistent nature of PFAS means that we must take a precautionary approach. North Carolina public health has already suffered enough from uninformed PFAS exposures. We know the Nordic Council released a study on the cost of inaction, and it showed that not acting on PFAS and healthcare costs alone would cost Europeans tens of billions of dollars annually. We only know what science can confirm, and for me, the purpose of science is for the betterment of humanity. Some may argue PFAS technology has benefited society, but I would say at what cost? Painful infertility journeys, shortened lifespans, illnesses and sicknesses, and populations younger and younger. It is time, quite honestly, for us to take up an approach that looks at PFAS as a class and with precaution that preserves our most vulnerable in the population. Thank you so much for your time.
Thank you. We appreciate your perspective and for sharing it. The next person that signed up to speak on PFAS as a topic as well is Dana Sargent with Cape Fear River Watch. Dana, have you been able to join us?
I have, thank you. Can you hear me?
I can. The floor is yours.
Thank you. Good afternoon, and thank you for hearing me. Again, my name is Dana Sargent. I'm the Executive Director of Cape Fear River Watch based in Wilmington, North Carolina. According to the Interstate Technology Regulatory Council, as of August 2020, Michigan, New Hampshire, New Jersey, New York, and Vermont have all established MCLs for some PFAS. As well, California, Colorado, Michigan, New Mexico, Delaware, Maine, Florida, Alaska, Pennsylvania, Hawaii, and Washington State have established or drafted target levels to trigger groundwater cleanup and/or response levels for surface and drinking water systems. Colorado, Minnesota, New Hampshire, and New York have banned PFAS in firefighting foam. Many, if not all of these states don't come close to the level of exposure experienced here in North Carolina. in total concentration levels, types of PFAS, or population affected. Yet they have taken action while we continue to study the issue. The EU established PFAS and PFOA and its derivatives as a priority hazardous substance and has established a 5-year human biomonitoring initiative. Moreover, they have proposed a directive to regulate PFAS as a class, with an individual PFAS level at 0.1 nanograms per liter and a total PFAS level at 0.5. Several member states already have drinking water and soil limits, and some have banned PFAS in textiles and food packaging. The US is a global leader in research, and for that, and for all of you in your work, I'm immensely grateful. Yet we are way behind in using this data to affect action. I respectfully request that in your advice to our regulatory bodies, you make clear that while of course we don't have yet enough data to prove every health outcome on every type of PFAS or combination of PFAS, and families living with illness need this data, we do know that health outcomes exist, based on the extensive work of the C8 Science Panel and countless other research provided by some on this board and others across the globe. That should be enough to stop industry from exposing us to it. As you know well more than I, the nature of science is that it can never prove anything. It can just disprove enough to get us to a reasonable understanding. I think it's safe to say we all have a reasonable understanding that PFAS is not safe. Yet we have seen through the passing of funds to the collaboratory instead of the DEQ that our legislators in this state, for the most part, goal is to delay regulation by claiming we don't know enough. And we know that they did that because the manufacturing lobby asked them to do that. We can and must continue to fund and study PFAS, but not under the auspices that we need more data before we can regulate. The regulatory body here in this state already has the authority and the ability to regulate PFAS without any more research. A few months after the story broke about Gen X in our water in June, a couple years ago, my brother, a Chicago firefighter and former US Marine, was diagnosed with terminal brain cancer. He died this past December. He was 47 and he loved life. We don't know if his glioblastoma was caused by his military or career exposure to PFAS, but we shouldn't have to wonder. Regulators and legislators will say we don't know enough to stop the manufacture and use of PFAS. In actuality, we don't know enough to continue to allow it. Thank you.
Thank you. Thanks for making the time to join us today and for sharing your comments. Important to hear all of these voices on our first foray into the mixtures and grouping topic. I'm going to circle back around one last time to see if Steve Risotto with American Chemistry Council has joined, since he was asking to speak about the same topic.
He has not. I don't see a Steve Risotto in the attendee list.
All right. And then I'll pause just a minute to see if anyone on the board has a comment then or question for Corey, for Emily, or for Dana, who did join to speak on this topic, before we move on to the two last folks who had registered to speak on a different topic. Questions for our three commenters? Again, thank you all three for your comments and your participation. Again, important to hear from as many voices as possible as we begin this exploration together. That will be the among the subjects that we tackle again in December, with another presentation or two and some more reading in between. The next person who registered to speak was David Burton on climate change. I'm not sure exactly representing who. So David, have you been able to join us?
There is not a David Burton on the attendee list either.
All right. So we'll follow up and see if David and Steve want to join us for the next meeting. And then the last person who registered to speak is Grady McCauley with the North Carolina Conservation Network, requesting to address us on the relationship between the Science Advisory Board and the Environmental Management Commission. Grady, have you been able to join us?
I have. Can you hear me okay?
It's a little faint to me. Can you try it again?
I moved the computer a little closer. Is this better?
That's better for me, yes. The floor is yours.
Thank you so much. I'm Grady McCauley. I'm the Policy Director at the North Carolina Conservation Network. I listen to your meetings, and I want to start by saying how grateful I am for your service on this board. I also, as a part of my work, listen to the Environmental Management Commission meetings and draft public comments on many of their proposed rules. It's felt to me that there's a gap sometimes between what you see yourselves doing as the Science Advisory Board when you offer recommendation and how it's heard by risk managers on the EMC. And this comment reflects both the recent action on methyl bromide, but also their incipient action on Pfas and PFOA in groundwater. Being outside both of your boards and commissions, I wanted to reflect on that gap for a minute in case that perspective could be helpful to you. My sense from your discussions is that you are conscientiously giving as accurate and nuanced advice as the public scientific literature will allow. Some impacts we can be virtually certain of. Others we think are very likely or likely. Sometimes you know that the body of science is moving in a direction, but not every piece of it is confirmed yet. Sometimes your gut tells you that what we know for certain is not itself protective, it's just what we can be fairly sure we know for certain. I think a nuanced read of recommendations that you make in that form by a risk manager, such as those on the EMC, would be that with respect to human or ecological health, you've offered a floor, and risk managers should consider how much further they need to go, given the trend in the science. In my experience, that's not how the EMC by default hears you. Unless you're very clear that you're saying something else, when you offer a number, it's taken as a ceiling by the EMC rather than a floor. That's what's happened on methyl bromide. It may be about to happen on PFAS and PFOA in groundwater. As you probably know, the EMC is a political body, and that's what it's set up to be with stakeholders from different perspectives. One way you see that is the vote on the methyl bromide standard was, I believe, 13-1. That one was the doctor on the EMC who felt and was explicit that she did not want to step away from the scientific value recommended by the scientific experts. But that's not how the body as a whole generally makes decisions. It almost always means that the outcome of the EMC deliberation is going to be a compromise away from what you recommend in response to pressure from other stakeholders, including responsible parties in the case of remediation, manufacturers, water treatment authorities, and so on. It's also worth noting that those stakeholders are often bringing information that isn't based on any public economic analysis and not based on anything underpinned by peer review either. So when your floor becomes a ceiling, it's a lower ceiling than the other kinds of information that are being brought to the EMC to counterbalance it. So to close, my recommendation is, as you're doing your recommendations, please be very explicit about what you're recommending. Be clear about the direction of uncertainty and the momentum of the science, and recognize that the outcome for regulation isn't likely to get any more protective than what you say we definitely know. And with that, thank you so much for your time.
You're quite welcome. Any follow-up questions for Grady McCauley? We appreciate you sharing your perspective. We do know that we're but one part of science-guided environmental management in the state, which is a partnership between the Science Advisory Board, the talented agency staff, the Environmental Management Commission, and stakeholders. So thanks for your perspectives as a stakeholder. With that, I'm going to call us to a close with thanks to all of the board members. Again, special thanks to all of those who've completed 3 years on the board as of this month. Very much appreciated. I want to thank the agency senior staff who joined early on and stuck with us throughout the entire meeting, and the technical staff as well. A special thanks to Louise and Peter and Mercedes and Bridget for technical support. And again, my thanks to everyone who I know is balancing a lot, have more demands for your primary job, demands of childcare, elder care. The times are certainly continue to change. I appreciate the time that people have spent on the board. And with that, we'll remind people that we will be meeting again on December 7th. The 2 items that I know will be on the agenda then will be the second iteration of this introduction on PFAS mixtures, and hopefully a vote on the final recommendations for hexavalent chromium. Thanks again for your time and have a good afternoon.
Thank you, Tom.
Thanks, Tom. Bye.
Good day.
Thank you. Bye.
Thank you. Bye.